Module 20, Nursing Care of Patients and Families. Take just a few seconds and read over your learning outcomes. Patients with chronic illnesses have long-lasting or recurrent illnesses. Their disabilities vary. It may interfere with their activities of daily living. Chronically ill patients usually are faced with altering their accustomed roles in life. Common roles that may be affected for the adult patient include that of being a spouse, grandparent, parent, provider, homemaker, or friend. Not only must the patient deal with these role alterations, the family must adapt to them as well. Chronic illnesses that you may see in older adults that are very common are your arthritis, your cerebral vascular accidents or CVAs, also known as a stroke, chronic lung disease. This could be your COPD, chronic asthma, dementia, Alzheimer's, diabetes. They can have type 1 or type 2, hypertension or heart disease. They could have congestive heart failure, orthopedic dysfunction. Older adults are more prone to orthopedic injuries, your peripheral vascular disease, their sensory loss. They may have problems with their vision or hearing. Gerontological influence on chronic illness. You can see that the elderly are living longer, family are having to take over the role as caregivers, adult children are caring for their parents, spouses are caring for each other, and then your family units are at risk. Families must learn to cope with the stress of illness, and it's often an unpredictable course. Most families develop ways to cope with the patient's illness the majority of the time and may become closer as a family unit. Sometimes it can cause the family units to part ways because of so much stress and tension. There's decreased socialization, loss of income, increased medical expenses, and this can really put stress and tension on a family. Daily living patterns are affected. These patients go from being the caregivers to being cared for. There needs to be established routines. If the patients are used to going out and doing certain types of activities, maybe those activities could be brought into the patient, but they need to be on a set routine so that the patient understands what's going on and it's something that they expect. I like this card. It says, "I'm so happy I got this debilitating illness so I can stay in bed for the rest of my life instead of participating in society and making a difference," said no sick person ever. A lot of people who develop chronic illnesses never expected to develop those chronic illnesses, so it really puts their lives into a tailspin. They have this life, this routine that they've always done, and now everything changes. And a lot of these patients do not do very well with change. We've already talked some about the roles. They may alter life roles. Families must adapt to the change. Nursing diagnosis, ineffective role performance, grieving, deficit in knowledge. And family need to understand that the patient is faced with giving up aspects of old roles at the same time that new roles are being introduced. Grieving accompanies the loss of old roles. If the patient is no longer able to participate in social events such as golfing or being a committee member, grief work needs to occur to help the patient accept the loss and maintain dignity. With other roles, only certain aspects of the role may change. For example, in the parenting role, patients may still function as a support system for a child, although they can no longer be the disciplinarian. Whatever role is lost, The patient needs to be allowed to grieve the loss. One thing that you have to look at when dealing with chronic illnesses in family is role strain. Patients are often concerned about being a burden to their families. It is important to determine both the family's and the patient's feelings about the care required by the patient. You have respite care. Respite care is an essential part of the overall support that families may need to keep their family members with a disability at home. The word respite means to take a break from the daily challenges of caring for a child or a parent with special needs. You have your chronic care coaches, and some of the nursing diagnoses include risk for caregiver role strain and caregiver role strain. Finances is a big deal to these patients. You want to refer them to financial resources if possible. Some nursing diagnoses would be compromised family coping, disabled family coping, and readiness for enhanced family coping. When caring for these patients, you want to respect the patient's wishes. You want to make sure you can include the family in any type of care you're giving to the patient. You want to teach them if they have dressing changes or if they're getting new medications, anything that you can teach the caregivers while you're actually doing it. You want to empower the patient to do as much for themselves as they can. Don't take away their right to do things on their own just because it's easier for you to do it and be done with it. And make sure to provide your patients dignity. Just because they are not able to do the things that they used to do, or they're debilitated, or they can't get up and move, doesn't mean that they don't still want that dignity provided to them. We have our review questions. What is the LPN or LVN role to help patients achieve the highest wellness level? Select all that apply. Your correct answer is 1, 2, 3, and 5. Which of the following would be a nursing diagnosis related to coping issues for a chronically ill patient? Select all that apply. Your correct answers are 1, 2, and 4. What nursing care should the nurse provide to the patient who is chronically ill? Select all that apply. Your correct answers are 2, 4, 5, and 6.